Hi, Dr. Verma.
Hi, Jyotsna. How are you doing?
I'm good. Thank you for taking the time out on a Sunday, that too. It
Good to
is
see
what it is. Good to always see you, but I keep thinking that we will see you in better times, and that isn't quite panning out. But a quick introduction, of course, Dr. Nitin Verma is the director of the pediatric department at the Madhukar Rainbow Hospital, Children's Hospital in New Delhi, and one of the top pediatricians in the capital, and very, very valuable advice. So I'm going to kickstart this without wasting really any time. Doc, you were saying that you're inundated with video consults. How bad is it now?
Let's say that I've done video consults today, and doing a video consult on a Sunday, I've probably done it after 15 years.
Oh,
Uh,
wow.
don't have a choice. These are times that you have to put your own comfort at the back burner and try and help out people. And believe me, people are in trouble. This time, I'm sure we'll discuss in detail. The number of children impacted is huge. It's really huge. So not able to keep pace. I mean, I pride myself in being quick, but not able to keep pace with the number of children who are rolling in. It's frightening.
So is it biting us a little bit that, we've been a little bit easy on the fact that everybody's been saying that this wave is mild, it's mild, not realizing that mild is a very relative word, isn't it?
So let me put it this way, that let's say in the Delta, uh, 30 out of 100 had moderate to severe symptoms, and in Omicron, maybe 5 have. But for those 5 who get severe symptoms, life is not very, very easy. What's also happened is it's not that we were not prepared. We were prepared in many ways, except being personally prepared. The problem is, being prepared means, is the government prepared? Have you done anything? What are you and I doing? You start having weddings with 500, 800 people. You go out. By all means, go out, but go out safely when you are there, and don't wear masks. Move around in large groups. Then sooner or later, trouble is waiting to hit us. Do remember that in the population that we've had, a majority of the adults are vaccinated. More than 90% of the affected population has got at least 91% one dose, more than 60% two doses. So to the best of what can be done has been done, right? But what about our own personal protection? So if you don't fend for yourself, then sooner or later you're going to be in trouble. And I think this time, we've let our guard down, and we've
Yeah.
brought it upon ourselves.
So where does this leave the children now? What is it that is worrying you the most? And I'm going to come to the symptoms and recovery a little bit later. But my first question actually on this with the children is that what is it about the children that you're seeing that is really worrying you?
So what's worrying me is the sheer number of children who are getting it, and they are getting it across all age spectrums. My youngest baby that I am treating is 4 days old, and the eldest
Wow.
I am treating is 17 and a half, and perhaps the eldest is 17 and a half, because I don't treat more than 18 years of age.
Right.
So, so no age group is has been spared. So they were the vulnerable population. The biggest problem with Omicron is forget whether it's mild or it's severe. We'll discuss that later in detail
Yeah.
as we go along. Is that it is highly infectious. If there are 10 people in the house, and with the previous wave, I mean, you were careful,
Yeah.
maybe 3 would get it or 4 would get it. In Omicron, all 10 will get. So it's highly infectious. So it spreads rapidly, and it's very nice. Doctor, my child has not gone out for 2 months, but you've been out with your friends having dinner at a pub the previous night, right? So you're the ones who are bringing it in. So the second you pick up the virus, you will infect everybody, and you will infect the children because they are the most vulnerable. Here, even the double
Yeah.
vaccinated and booster are
Yeah.
not being spared.
Booster. Yeah.
Yeah, yeah.
Yeah.
So I think, as I said, that, sorry to be harsh, we brought it upon ourselves. We should have been a little bit more careful rather than saying that, X and Y didn't help us. We have to now learn with COVID, we have to learn to stand up and fend for ourselves.
And of course, the vaccination. I mean, do you think that the 15 to 18 has come late enough, and that we should actually have been vaccinating a much bigger age group?
So you have to look at it from a different perspective. You also have to look at the kind of numbers and population that we have, and you have to look at it dispassionately from a medical point of view. There is more danger to an adult getting COVID than to a child. That's not to say that there is no danger to a child. And therefore, you have to go and, start, giving the vaccine to those who are more at risk. That's point number one. Point number two, when we were looking at vaccines to give to children, we had a limited choice, and we had to wait for the studies to go to see that they were safe for children. A normal vaccine development can take 8 to 10 years. These are emergency approved vaccine. Isn't it frightening? You're giving a vaccine to yourself or to your child, which has been tested in 3,000 people in India. So they needed to be sure that the vaccine that were being offered to children, and remember, we don't have the mRNA vaccines with us. We don't have the Pfizer and Moderna, which is being given outside. So we needed to be sure that the vaccine that were being offered to the children were safe. We needed for the trial to get over. We needed for the reports of this trial to come. So efficacy, effectiveness, and safety. Safety is prime, is something which is really important. Could it have happened? Maybe, but the time frame was very, very short, and it was obviously being rolled out to a huge population which was there. So I wish it was earlier, but at least it started. And surprisingly, the response is not very good to people. It's everybody. Those who are crying themselves hoarse that my child is not getting a vaccine. But those who are there, I'm sure there are a lot of listeners who've got children in the age of 15 to 18. I wonder how many are vaccinated. So
there's also been skepticism, right, for Covaxin.
There should be no skepticism for Covaxin. You look at it, there is a obvious impression that something which is imported is better than an Indian vaccine. You have to look at the technology of how a vaccine is made, right? So I won't go into medical details because it would confuse people. Suffice to say, Covaxin is a killed vaccine, right? So there is the danger of side effects are minimal. It's pretty much like the flu shot, which all of us take every year. Yeah. So it's safe. Maybe it'll work in about 60 or 70% as compared to 80 or 85 of the other vaccine, but we won't have the side effects. The world is still looking at what the side effects of the vaccine and the side effect of COVID are, because at the end it only started in 2019. We talk and we preach about Omicron. The first case was reported on 24th November 2021. It's not even 2 months. Yeah. So yes, there is skepticism, but how would I put it? If today I had a choice in India to take a vaccine, I would happily take Covaxin. I don't think there is any flaw with it. How effective it will be, time will tell, but the vaccine does not prevent you. So this is something which everybody must understand. Vaccine cannot, the virus is smarter than us. Vaccine doesn't prevent disease. But what it'll do is it'll prevent disease to a large extent. It'll prevent severe disease, and the chances of your going to the ICU and dying are much less than if you've not been vaccinated. And we've gone through data. I'm talking of data not only of India, but across the world. And more than 81% of the people in ICUs and requiring oxygen are unvaccinated. Just come back from America after 3 years, and they are reporting 1.3 billion cases a day. They won't wear a mask. I mean, they thought I was a man from Mars. I was wearing a mask inside the car, and there, unless you go inside a closed place, they won't wear a mask. So maybe
Absolutely.
at some stage we'll discuss about that later. But yeah, yeah. So what we need to do is we need to pull up our stock, and start looking after ourselves.
Yeah, so before I just move on, I'm trying to preempt a question that could likely come on the vaccines. A lot of people are trying to, get their children vaccinated in the UAE or the US, wherever they can possibly get, and they want to know if the mRNA or Pfizer is okay, and if they can go below the age of 15 to get their children vaccinated, if they can manage elsewhere.
So dispassionately, the answer is yes. Okay, there are concerns about the mRNA vaccines, but they've been used in millions of doses. Okay, for adults, it's no longer an emergency approval. It's a vaccine which is licensed. So a lot of doses have been given in children from the age of 5 years onwards. And if somebody had an opportunity to go and get his child the vaccine, I would say the answer is yes. You can go ahead and take the vaccine if you have the opportunity to do so.
Okay, excellent. I hope that is clarifying for a lot of the viewers here. Now I'm going to go back to where we are right now, Doc. What are the main symptoms that you're seeing?
So we know that actually it's a virus, right? So it's a kind of a flu virus. So it's a respiratory virus. So it normally will present with the first most important symptom is fever. So the commonest thing that will come is that the child has got fever. The second most common symptom is cold and cough. It's mild. It's not so much in this as is there. That's not to say that some children won't have a really bad cough like a flu kind of cough, but there is cold and cough. The third and very interesting symptom that is coming across that these children are presenting with is pain abdomen. So, they present with vomiting, loose motions and pain abdomen, giving an impression. We always think ना हमारे बच्चे को तो कोविड हो ही नहीं सकता because हम तो बाहर गए नहीं ना. So you need to watch out. So if your child presents with vomiting and loose motions, pain abdomen, think of COVID. In some cases, we are seeing children with a rash, and in a very small proportion, we are seeing children who are coming with a red eye, so symptoms of a conjunctivitis. So broadly, fever, cold cough, and vomiting, loose motions are the common symptoms that we are seeing children with.
Just wanted to answer a question. Yes, Doc will take a few of the questions in a while. I will ask all these questions as soon as I've done with the basic ones. So, Doc, when is it that a family needs to be red flagged and move the child to the hospital or go see a doctor?
So, the COVID is a disease which, unless it becomes severe, is managed remotely, right? So the first thing to do is to suspect and identify that your child has the disease. The second is to connect with your pediatrician remotely through a video consult, because when you go and meet somebody, then there is a chance of it being passed on to the other person, and vice versa. After all, a doctor is working in a hospital. If you don't have, you can pick up a disease from there. So there are some red flag signs that you need to look out for. And obviously things that we will monitor are the temperature, the pulse, and the oxygen saturation. So the oxygen saturation is best monitored on the middle finger of the hand, and any reading of 94 to 95 and above is safe. If you have a reading which is less than that, then you should try and do a 6-minute walk test, so that your child walks for about 6 minutes, and then you measure the oxygen saturation again. If you find there's a drop in the oxygen saturation, then you must take your child to the caregiver for a physical examination. The second red flag is fever, which is not coming under control. Normally we are seeing that children get fever and it tends to last 2 to 3 days and then tends to come down. In some cases, it may last 4 to 5 days, but it's a low-grade fever, 99.5, 99.6, not requiring. So if the fever is persisting, you should go to the care. The third thing is cough. If the cough is very intense and is coming in the way, then we have to look to see whether the child is developing lower respiratory. Upper is ear, nose, throat. Lower is the lungs, whether it is going into the lungs, and the child needs to be examined and maybe an X-ray or a CT scan taken. What we normally do is that we monitor the child around day 4 or 5 if there are indications, and they are much less in children as compared to adults. We do some blood tests to look at inflammatory markers. So there are 5-6 tests which your doctor will advise you, like a CBC, a CRP. You do an LDH, ferritin, IL-6, D-dimer, basically to see that there is no clotting or there is no inflammation which is happening in the body. Why is that? Because that may be an indication to add more medicines like a steroid, which is, mind you, normally not given in children unless there are special circumstances. So if any of these things happen, you should then visit a healthcare provider so that the child can be physically examined, oxygen saturation taken in a more scientific manner rather than the small probe that all of us have got in our house, and the child be examined for any signs that would warrant hospitalization and closer monitoring as compared to treatment in the house.
So what I'm hearing is that the fact that loss of smell and taste is not part of the mix this time. Is that true, Doc?
Oh, I can see my good friend Shivani shooting question after question. Hi, Shivani, how are you doing? So, yes, so it's not, so we've become a stereotype that, is that there used to be loss of, so can you get it? Yes, but it's much less as compared with the Delta. So if we say that, I often have a mother will contact me, oh, he's fine, he's not lost his smell or taste. That doesn't mean that, the disease is not there or it's not severe. It's happening, but it's happening to a much lesser extent. I'll also answer one of the questions which was asked that, can we give other, things like Meftal and Ibugesic? The answer is yes. We give them with caution. So it's important to give paracetamol in the correct dose, which is 15 milligrams per kg per dose, which can be given every 6 RD. So if you do that, and despite that, in the acute phase, in the first 2 days, the fever and pain is not coming. And there are children who are presenting with very severe body ache, very severe pain. I have children who have such severe leg aches that they're not able to walk. Then, yes, we can use those medicines as well.
So there was another one here. How does one know what variant it is? Yes. So that's the other worry, right? I mean, a lot of cases are going on and on. The symptoms are persisting for a very long time. There are some. I mean, we have the problem of lack of genome testing, sequencing as well. But there's a big worry that Delta is in the mix as well. How does one kind of figure that one out, Doc?
So the only way to do it is genome sequencing. Look at the sheer number of tests which are done, right? And I should say maybe look at the sheer number of tests which are not done. So if there are 1 lakh tests being done in Delhi, there are at least 3 to 4 lakhs, maybe 10 lakh tests which are being done in the house with a home kit. And obviously, if in a rapid antigen test your child is positive, you know that your child has got. People are scared to get the test done. So to then try and do genome sequencing for everything is a difficult task. They are being done. We have to understand that we don't have such a robust, reporting system. It's coming in place, and there are very few labs which do, and it's being done. So we know that broadly, maybe about 70 to 75% of the cases that are happening are Omicron. And my counter question to people asking me, is it Delta or Omicron, is what difference does it make? So we are at the end, we are treating what we are treating, and we can just hope and pray that you get the milder variant. The adults, I think a huge percentage of the population has already either had the disease or taken the vaccine. So you saw that, Diwali came and went and we held our breath and said, here comes the next wave. It didn't come.
Yeah.
Right? People, शर्मा जी की शादी में तो 500 आए थे, तो खन्ना साहब की शादी में 800 लोग आएंगे. Nothing happened. We got away. So till the new variant came, which was highly infectious, we did develop some kind of an immunity. And I think we'll have, sorry, go ahead.
No, but wouldn't it make a difference, when we're looking at recovery? Because, when we had the Delta and the second wave, MISC, cardiac issues, heart issues, all that kind of stuff also came into the mix, post-COVID during recovery.
So it's not, MISC has not started. It starts 4 to 6 weeks. So while all of you are going to say, this wave is over.
And we are the doctors as well now.
Doctor, I've just recovered. Do you think I can go to Goa? Or when do you think I can travel? So, so these thoughts are, it's natural. I'm not blaming people. When everybody is resting, the doctors will be working, because 4 to 6 weeks after the wave is over, that's when the MISC will start. So the job is not done. But you see, when you look at variants and you know that there is little that you can do to prevent it, there are severe variants. Those severe variants don't travel very quickly to others. So, the infectivity of a Delta was less than and it lasted for a longer period of time. And Omicron spreads quickly and gets away quickly. So it may, I'm not saying it is, it may just be the booster which all of us wanted and didn't get. So will it then provide immunity against all mutants and variations? Nobody can say. But all that we hope and believe and pray is that, just like the swine flu, if you remember many years back, there was a epidemic, swine flu, and now what is swine flu? It's just like another virus. You take your yearly shot and you learn to live with it. At some stage, the epidemic will become an endemic. We'll still need to learn to protect ourselves. So, when we went to Japan and we looked at people wearing masks and washing their hands and looking at distances, funny guy, Now we all have to be funny guys. We just need to be careful. And as more and more people get it and the vaccine rollout comes to children and small children, I think life will become a little better for all of us.
So what is the average recovery time that you're seeing in children?
So most children recover within 5 days. So, and the infectivity is unknown, because there is no indication to retest again. And the reason that people retest is not because they are unwell. Will my quarantine get over and can I get out? But sometimes it's you pick up the dead virus in the test. So, the test may be positive for 10 days, 12 days, 14 days. So the rule of the thumb is you quarantine for 10 days. And the rule of the thumb is if you've done a RT-PCR, then 7 days post the RT-PCR, you should be reasonably safe. But we have to think of others. Don't think of yourself. If you are still infective when you go out, then you go and infect other people. So we should learn to live in peace and harmony within families inside the house. 5 days is what we are seeing in almost about 90% of cases.
There's confusion also about the asymptomatic cases. How are we looking at that? I mean, people don't know whether they should be medicating, what they should do. Should the child be isolating? How long should the child be isolating? How long, once you've got COVID, do you need to get your RT-PCR done again? When can you mix with the family? So the only, in the earlier ways, it was that I've had exposure. What should I do? I should start with vitamin C and vitamin D, and there's a 50% chance that I'll escape. There is no such chance with Omicron. If you've been exposed, there is a very good chance that you will get it. So the only way is to isolate. Asymptomatic children and asymptomatic adults require no treatment. But because
whether by design or by chance, that they are infected and can pass on. If we isolate them, then the spread goes a little less. There is no indication for a repeat test. So I'm again saying it in black and white. There is no indication to repeat a RT-PCR unless there is a medical indication for that. So if your doctor is not asking you to do it, please resist the temptation of putting strain on the system just because you can afford it and getting another RT-PCR. Somebody else will probably have to wait for a day to get the test done. So no indication to repeat. Stay home for the minimum period of time. If you're asymptomatic, eat a good diet, drink lots of fluids, take a high protein diet, and you should be all right.
So is it, the whole vitamin C and zinc thing, is that concoction still working?
Yes, it's working because we don't know anything else. So we know, science tells us that you require good antioxidants and things which enhance the immunity. And we know that zinc, vitamin C, and vitamin D are important as adjuncts to enhance the immune system of the body. So these should be taken. Most of us are taking vitamin D regularly in any case. We just like to bump it up a little bit because of some studies which show that, the people who have higher vitamin D levels tend to fight the COVID a little better.
Okay, I'll just quickly take a few of the questions on the side, Doc, if that's okay.
Please.
If and when schools do open, is it safe to send unvaccinated kids?
So it's a tough one. You have to look at it from two aspects. One aspect that we look at is that you're sending a child who's unvaccinated. There is a chance that he can get COVID, and there's a chance that he'll come back and then infect the elderly people in the house, because we are in joint families. So there's a grandmother and a grandfather living there as well. The flip side is that there are serious side effects coming in of children not going to school. There are huge psychological impact. There's a huge impact on nutrition, obesity, and there's a huge impact on parents who are forced to cope and live with children in the house, right? So this is what I would say. Make sure that the school has good COVID protocol. Make sure that everybody in the school where a child is going is vaccinated. Make sure that there are stringent protocols of looking at somebody, and start sending to school. The bigger children may start first. So, children who are 8 years and above may start first. You may continue with online for a period of time for the younger, and try and roll out the vaccine as quickly as possible across age groups, so that we then have a mix where you're vaccinated, and the risk, however big it may be, is much lesser. You have to keep the odds in your favor.
Yeah, fair enough. So Shpani is asking, would you prefer an mRNA vaccine over the old-fashioned technology, keeping in mind reports of inflammation in the heart and stuff?
So Shivani, my good friend, it's not a question of what choice I have. It's a question of what's available to me. Would I like? Yeah, I'd like to have dinner with you tonight, but I can't come to Dubai, right? So that's not the point. The point is there is science, and then there are reactions which come in. So to repeat what I said, these vaccines were developed in a very, very short period of time because of what the world was going through. Are there side effects of the vaccine? Yes, there are side effects of the vaccine. Are they strong enough to say that you shouldn't give it? No, because the advantages that they have far exceed the side effects that we have, and we haven't developed all or know about all the side effects. It's still going in. There are countries outside of India which have a very robust registry of reporting all side effects, and it's being done, it's being researched. The only problem that we have is that a lot of medicine and a lot of things that happen are dictated by the pharma lobby. So and the people who fund these researches and the people who fund it is the pharma by itself. So there are times when there are going to be conflict of India, of interest, but the truth will prevail. So at the moment, yes, I mean, I wouldn't have minded taking a mRNA vaccine as a booster over and above what we did. But I'm not trying myself force that I didn't have and I had to take a booster which was made in India. I'm quite happy to have gone about it and see. Maybe 1 year later, if Shibani asks this question, I will have a better answer for her.
Yes, we are all. I hope we are not in a situation where we're still discussing this 1 year later, though, Doc. But who knows?
I sincerely hope not. I sincerely hope not.
Really.
World needs to quickly normalize and come back to normal activity. What's happening is not healthy for individuals. I'm talking of physical health. I'm talking of mental health. The number of children that I'm seeing who are not happy to go back to school, who are obese, who are having huge amount of issues, is large. It's not funny. I mean, I think maybe 10 years later, the only with artificial intelligence, the only doctor who's still going to be in business is going to be the psychiatrist. So there's a huge thing. There is a need to come back. The world is moving towards it. I think just as long as we are all in it together and we we are scientific in what we do, then I'm sure maybe 6 months, 1 year down the line, life may be a little better.
But isn't there always a worry? The more it transmits, the more there are chances of fresh variants coming out, and the way Omicron is transmissible, and is quickly spreading, the worry remains.
So we've had way down in the ages, from the Spanish flu epidemic to plague to SARS, to so many epidemics that have had. Viruses tend to peter out and die a natural death. So we are optimistic, as I said, that after a period of time, it'll become endemic. It'll be there. We'll have much more knowledge about it. We'll have a vaccine against it, which hopefully most people will take. And if we get it, it'll be like the normal flu. So it's not that there is no influenza or there's no H1N1 or vaccine preventable diseases which people don't succumb to. But hopefully in the near future, things will get a little better.
Hopefully. Always hoping on to that, hoping that the cup is half full, Doc. But there's a question, any immunity medicines?
So honestly, no. So if during the Delta wave, somebody asked me, okay, can you prescribe? I may have been tempted to prescribe vitamin C and a zinc. But here in this, we've seen that even if you prescribe it, if you have to get the disease, you will get it. So immunity comes out of eating a balanced diet. It doesn't come out of eating. So it's not if you pop in a Bicazole or a vitamin D, you'll suddenly become a superwoman, right? It comes from eating a balanced diet, having good activity, sleep. Very, very important thing, not spoken about as much as it should be. For good health, sleep is extremely important. So those who eat well, hydrate themselves well, and sleep well tend to have the best immunity. So I think just focus on what is in our hand, and in our hand is eating well, sleeping well, taking a high protein diet, drinking adequate amount of fluids. That's something which is in our hand, and that's what we should focus on.
What is the safest way to interact with a child who has COVID as a caregiver?
So there are some circumstances where you cannot isolate. So it depends on how big that child is. So if it's a small child, you have to interact. After all, doctors work with COVID people in hospitals, right? So they don't say that he's COVID, that, I won't see. So you have to wear an effective mask. You have to wear a N95 mask, ideally double mask. So over the N95 mask, you may wear a surgical mask. So if you have two masks, wash your hands and keep a distance of 6 feet. There are good chances that you will be able to prevent it. When you go out, wash your hands. If you have to sleep in the same room, you have a 3-year-old child and you can't leave that child alone, then sleep at a distance of 6 feet, wear a gown, wear gloves, keep washing your hands, keep using a sanitizer, and keep your mask on even when you're sleeping at night. That's the best that we can do.
This is for yeah, and I think that's a good answer also for those who have younger children. But her daughter is 11 going on 12, so
So at 11 going on 12, we can try and remote manage a little bit. So the you can video talk with the child, or you can talk at a little bit of a distance. You have to monitor. You can't expect an 11-year-old girl, though I know many 11-year-olds who are much smarter than I am, but can't expect them to monitor their own oxygen saturation, take their temperature, but encourage them and keep the interaction to a limited period of time, because a bigger child can look after himself or herself.
so is Omicron mostly affecting upper respiratory system?
Well, yes, that's not, you're not getting pneumonias, but yes, as compared to the Delta, it seems to be a virus. I'm using my words carefully, which affects more the upper respiratory tract than the lower respiratory tract. And so sometimes you can have secondary infections which come in, and everything gets linked to COVID, right? Somebody has a heart attack, says, see, he had COVID. He has a heart attack after the vaccine. You say, see, he the vaccine, he's had a heart attack. So yes, but so far it seems that it's affecting the upper respiratory tract more. The number of cases are huge, but the number of cases requiring hospitalization is not as much, and this is for children. I don't have the adult figures, and we are inundated, but we are coping. The hospital wards are not full of COVID patients, despite the large number of children getting it.
Okay, that is excellent news. I was going to ask about hospitalization. Before I ask the next question, it's only fair, since I'm reading all the questions, to also read the fact that someone, Gaurav Gupta, has written that the best pediatrician that India has seen. There you go, doc.
Gaurav Gupta, besides being a friend, his child is my patient. He's biased. Let's not look too much into it. He's a good man, but everybody is fond of their pediatrician. It's fine. Thank you, Gaurav, but that's not true.
I second it. But is that fear of reinfection, if you've gotten it once, also can one still be a carrier for our kids?
So, two separate questions: fear of reinfection and carrier. These are two separate points. Fear of reinfection, yes. I have a huge number of children who've got. Oh my, you treated him in April when he had it. Well, your child's COVID positive again. So huge number of children who picked it up a second time. And carrier, so a virus normally stays in the upper respiratory tract. And there are periods till which it can stay. This virus is seen that sometimes it may stay for 2 weeks, 3 weeks, 1 month. So you can be a carrier. Certainly you can be, but if you've done your period of quarantine in the proper way, the chances that you will be a carrier are very little.
Okay. Oh, another one for you, Doc. Isha says, thank you for taking care of all our babies and answering us all day and night. I second that, since my time difference. You're still answering to my time difference. So, that one is from me as well. If the child has fever for 2 days, but the RT-PCR, okay, that's not a complete one. So I'm hoping that answered. Divya, if you can write again. Is it okay to only quarantine for 1 week?
So as I said, that the purpose of quarantine is not, it's, so you have to stop looking at it as a punishment. It's not. You're preventing spread from you to the next person. In Omicron, it's not even worthwhile trying to trace the contacts, but you should tell anybody and everybody that you've got it so that they can diagnose for themselves. But you have to, at some stage, prevent it going from you to the other. That's the purpose of a quarantine. So, as I said earlier many times, do not retest. Quarantine for the requisite period of time, and you'll be safe, and hopefully your friends will be safe as well.
I'm taking another 5 minutes. Do you have another 5 minutes, Doc? I've gone over the time.
Sure. I'm free.
Thank you. Okay, Shubhani, this is the last question. Next time you're calling the doc. Does the treatment change with the results of genome sequencing?
No, it doesn't. The only thing is how should I answer it? It's like you have a heart attack, and then after the angiography, the doctor says, "Oh, it was the inferior one, which is the safer." You feel better, but they're all the same.
Yeah.
Need to be careful. You do know mentally in your mind that you're dealing with something which is milder, and hopefully the chances of your getting severe disease are less. Not to say that you can't get it, but you still have to observe the same precautions and take the same amount of rest, and get back to normal life in a phased manner once you have recovered.
Nitya is asking, it's been in the news, I think it's also been in the WhatsApp forwards, that everyone has to get this variant once. It's a natural vaccine. How true is that?
So I'll answer it by, and Nitya is like my daughter, so it's a WhatsApp for.
I lost. Yeah.
The infectivity is so much that everybody will probably get it. The good thing is that some people will get it and not know about it. And if you have an opportunity of getting some kind of immunity by something which is very, very low virulence, it's not a bad thing. But please note, we don't know what will happen to us 10 years later, even with a mild variant. So, there was 20 years back, when you people were young, if a child got chicken pox, all the children were made to lie on a bed. Ki chalo, Siapa Mukhya, everybody is there, and you get chicken pox and you get immunity, right? So it's not like that. It's not a nice disease to have. We don't know what are the long-term implications. We are only beginning to understand what is happening, but it's a fair assumption to say that a huge majority will get it. That's because it's so infectious and we are not careful.
Yes, I think that's the part that we aren't looking at very deeply. What will happen in the future? And I'm going to come to that. Before that, board exams beginning in the first week, February. How safe are the children?
Difficult one to say. So, like with all diseases, there'll be exacerbations and troughs. So, if it comes in at a time when cases are less, then it should be okay. So it's just a question of preparing for it, right? Just as you prepare for something, you have to prepare for a child going. So if you create an infrastructure where a child doesn't come in contact with anybody, wears a mask, there is good airflow, and he's being monitored and he sits at a distance that he can't infect everybody, there's no reason why he shouldn't take the exam. Life has to go on, right? But if it is happening at a time when you're in the middle, say like this, if the exams were tomorrow, I would say we have to reschedule them. So you have to play it by the ear. You have to be smart. You have to learn to live with the disease. We can't wish it. I mean, we've been wishing it away. Everybody said 2021, the pakka is going to be a great year. It wasn't. 22 started with a bang. So, we're still hoping, as I said, at least 20 people have messaged me today. I am recovering. So how soon can I travel, So it's a question of being smart, seeing what is the correct window and doing what we do. After all, we did all go back to work. We did all go back to office. We still did start moving out. Do it in a wise manner. As long as you do that, anything and everything is possible.
People are still coming positive after 15 days. So should adults be around small kids even with a dead virus?
So that's a difficult one which is there. So we as I said, this is people who are retesting themselves when they are not, and perhaps the reason of testing is very simple. I'm negative. I can be out of my room in 5 days. So what you should do is you can just continue to wear a mask. That's all that you need to do. So you don't have to quarantine for 6 weeks if you're still positive. Just wear a mask and go across with your normal activities. Most probably it's the dead virus which is coming out in the test.
supplements to be given to kids to help them recover post-COVID?
So simple one. So yes, give them a good diet. Give them a balanced diet. 50% of your diet should be fruits and vegetables. No child eats it, right? Give them a high protein diet. Give them adequate amount of fluids. Avoid junk food. So there is a cross reaction of what you want to do. I'm okay. So today I'm going to have a pizza. Your treat is equal to something not healthy. Yeah. So of course you can do that. But point is, if you balance it and have a high protein diet, yes, you may continue. I'm sure this question, if it hasn't come, will come. You can continue to zinc. 15 days should be more than enough. You can take a normal vitamin C can be given for a longer period of time. It's a water soluble vitamin. If you have extra, it will pass out in the urine, so you're not going to retain it, but don't overdo it. So there is a takeoff between taking something from a natural source vis-a-vis taking a synthetic. So you have no choice. At one stage you're taking a synthetic, but if you can have it manufactured normally by having a citrus fruit or eating a piece of amla or eating fresh leafy vegetables which give you your daily requirement of vitamins, then that's a smarter way to move forward.
So, for those who are sticking to giving the vitamins, is there a particular dosage you recommend?
So, honestly, you have to understand. So, there are prescription medicines and there are OTC, over the counter. OTC medicine is a medicine which looks really nice, like a gummy bear, which you pick up and then you message me, Dr. Verma, can I give this to my child? So if the doctor wanted to prescribe it, he would do it. So there is, to put it in perspective, there is a minimum daily requirement of how much you need to take, and that is met by a balanced diet. The only supplement vegetarians need to take is to periodically take a little bit of iron, because vegetarian food, though healthier than non-vegetarian food, sometimes doesn't contain adequate amount of iron because of what we eat. But beyond that, I'm not a great believer of supplements unless they are required. Vitamin D, you should continue once a month, or depending on your child's age, your pediatrician will advise it to you.
So, Doc, we were talking about what is there for us now in the future with 2 years of putting our head down. How do we look up? What is the way forward? What do you see?
I wish I had an answer for you, and the truth is, I don't. I can only. I'm not one of those who I'm a scientist. I talk science. I talk what I know, and I don't believe in saying that, oh, I've been practicing medicine for 42 years, so this is how it goes. No, it doesn't work that way. Our experience with viruses which have hit the world over the last few centuries that we know show that over a period of time, the virus will keep mutating, but the virulence of the virus by and large tends to go lower and lower and lower. And immunity starts developing as you get. So immunity is not measured by the level of antibodies that you have. So you can't just brandish, see, I went to Dr. Dang and my report is 120. You're still as likely to get hit with the virus with somebody who doesn't have. So the body has different types of immunity. It has memory. Just like you'll have a memory of what your husband did 20 years back, right? So it has a memory and the body memorizes. So when there is a challenge with the same virus or a similar virus, the body produces antibodies which neutralizes. It depends on the virulence of what is coming. The way forward is for everybody to believe that vaccines are good for us, that we should all take vaccines. Wait for the recommendations to come. Don't run after that, America wants to give, or Israel or UK is giving the second booster. We don't know. Wait for things to happen. Believe that the knowledge that is there is correct knowledge and is based for your good. Nobody gets any brownie points. Majority of the people are being offered their booster doses free of cost, right? So it's not that it's not those who can afford to pay can take it, but it has to be done in a phased manner because the magnitude of people involved in India is so huge that you have to protect the vulnerable. Just as I would first give food to my grandmother and then to my mother and then to my children and then eat myself, that is exactly the principle which needs to be followed. So I see the disease going down in the near future, fingers crossed. I see us coming back to a more normal life, and I see us moving forward, but I see us moving forward with caution. Just as you wear a sweater in winter and think nothing about it, wear a mask and think nothing about it. Wear a fashionable mask, but wear a effective mask, right? So the mask is not just to look good, it's to protect you from a disease. I see that as the vaccine rollout goes and more people get immunity, I see the intensity of the disease going down. I see us coming back to a pretty much normal life. Will it be what it was before March 2019? I don't think so. Not maybe for a year, but yes, that's what we are hoping and praying. So I see us moving forward. I see children going back to school. I see us traveling. I see myself taking my wife out to a nice restaurant for a dinner, but I'll do it with caution. I'll do
I
it
am
with.
very envious. I'm very envious of those photos you put up. I'm still I'm still trying to convince my husband to take me out for a nice dinner. So I'm
I'm
like, oh
sure.
my God, Doc is on a break. He's on a holiday. So, but it's fabulous. I think it's much needed. Whoever can, whenever we can, I think we all need to take that out. A quick couple of questions before I let you go. After COVID, when should you get the flu shot? After how many days, weeks?
So strictly speaking, you can do it anytime that you want, but I would say 2 weeks. Remember the there are different types of vaccines. There are live vaccines and there are killed vaccine. The flu is a killed vaccine. So by way of caution, I would say give it a period of 2 weeks and you can take your flu shot.
Any precautions for children who recovered from COVID, as in can they play outside?
So,
And should we still keep children? Can children generally also play outdoors, or should we keep them in
so this is
right now?
something which Shibani and Radhika will relate to. So please look at the air quality index of Delhi right now. It's
Yeah.
probably over 400. So you shouldn't be outside. What you need to do is that there is something called convalescence. I can best explain. I go back to the time that I was in the army. When somebody got jaundice or he had a pneumonia, he was sent on sick leave. The purpose of sick leave was for him to recover, convalescence. So you need to give your body a period of convalescence. So that's not to say that you shouldn't have normal activities. You should not have strenuous activities for at least 1 month post the COVID. Remember, the figures for children and severe disease is still coming in. We do know what is there for adults, but for children, it's still coming in. So I would say come back to normal activity, but don't send your child for tennis. Um, see, at least 1 month post recovery from COVID, you need to be careful.
If a child has had COVID and has 90 antibodies, can we hold off vaccination for a short while?
So ideally, whether he has 90 or he has no, we know that whether it's a vaccine or the disease, the purpose of that is to provide immunity. And therefore, if somebody has had the disease, then he ideally should not take the vaccine for a period of 3 months. So if there is a 16-year-old who's had COVID and he's due for his COVID vaccine, I would say he should wait for 3 months before he takes the vaccine because he has natural immunity. So there is no reason to rush and take the vaccine as soon as you've recovered from COVID.
Is there any vaccination that is coming, any other vaccination that is coming soon for the kids?
So there are different types of vaccines which are there. There are vector vaccines like the AstraZeneca. There are killed vaccines. There are RNA vaccines. There are mRNA vaccines. The one which, to my mind, holds something which will be safe and which will perhaps give us very good immunity, maybe against variants, is the nasal spray vaccine. It's in the process of developing, and I'm certainly looking forward to that coming out because it's easy. You don't need to take a jab. So children don't need to, keep going back and taking. It's unpleasant whether you like it or not, whether there is pain or side effect or not. It's not a nice thing to take an injection. So that is something which holds promise, and in the medical fraternity, we are eagerly looking forward to that.
Excellent. And if they have taken a COVID shot, do we still need a flu shot?
Of course, there are different things. It's like saying, if I've used the sanitizer, or I've sprayed myself, do I need to take a bath? Of course, you need to. There are different diseases. So you have to understand that when you look at the history of epidemics in the world, whenever there was an influenza epidemic, there were more bacterial diseases and vice versa. Because one thing lowers your immune response and makes you more prone to pick up the next disease. So you must take the flu vaccine. What's the flu vaccine? It covers only 4 strains. There are more than 288 strains which cause flu. The biggest one is RSV, respiratory syncytial virus, against which there is no vaccine. But these are important strains which have hit the world. WHO decides which are the strains which have hit the world, most in the last 12 months, and then decides what goes into the flu vaccine. So yes, I think everybody should take the flu vaccine.
I'm heading there tomorrow then, because I'm done with my vaccine. I did with my boosters, and I said, okay, let it go now. But I gave it to the kids after asking you, but maybe I should too. Okay, I think it's time to wrap up. Just one last question. We've gone half an hour over. Can we hold off vaccination on a 15-year-old if she's had COVID? After another similar question, after a child gets COVID, how long should one wait to take the vaccine? 3 months.
Yeah.
And I think Doc has already, Manika, specified how long we should give zinc and vitamin C. Yeah, I think I've got to wrap it up, guys. I'm sorry if I've missed. Is 7-day isolation enough, as mentioned by the government body, for adults around small kids, with kids who are negative?
So, so I would say, as a rule of the thumb, not what the recommendations are. And please note, recommendations are being changed every day. Now healthcare workers, if you have mild symptoms, you're not meant to test and you're meant to go and work because they don't have enough healthcare workers, right? Frightening. But rule of the thumb, if 10 days from the onset of the first symptom and 7 days from a positive RT-PCR, you need to quarantine for that period of time.
Kids aged 1 to 4 have mild fever, cold, cough. Do we still need to do a test or wait a few days?
So the answer is very simple. Treatment remains the same. It may be academic, but I'm going to counter you with the question. Are you isolating this child? So if you're isolating this child and following all the precautions that you need to follow for COVID, and if the symptoms are mild, you don't need to test the child. But if you're going to say, to khansi zukham hai, and let that child meet everybody, then it's good to know whether he's got COVID or not, so that we can prevent its spread to other people. He'll have a cold and cough, and you'll send him to the neighbor's house. Ki ja pappu ke saath khel ke aaja. So it's a question of knowing, because when there is knowledge, then we take precautions. So you don't need to test mild cases, but it's so easy. You have home kits and you can do it yourself and avoid, going and standing in a line or calling somebody home for RT-PCR. So ideally you should test, but in mild cases, if you don't test, but if you isolate, it's perfect. It's fine.
Okay, promise you this is the last one. I'm apologizing to everybody else whose questions I've not been able to take. But we've been with the doc for 1 hour, so I have to be kind to him. It is his Sunday evening after all. I mean, kind of, sort of. Doc, Mansi's question, I've been hearing it's now an airborne disease. Well, yeah.
It was always there.
Yeah.
So
But
yeah,
now everybody says, it came into the middle and it's a little bit more transmissible in the air than it was previously. Or,
it,
that those seconds that you need to get out of the elevator is quicker.
yeah. So it's taught us many things. It's taught us, not to use lifts, and I don't use the lift in the hospital. I climb up. I have to go five. So what I do is I'm smarter now because it's difficult to breathe with two masks. I pace myself, reach the top, and then I come down. I don't keep going up and up and up. Yes, you need to. It's a aerosol. The virus lasts for different periods of time in different conditions and on different surfaces. So, uh, three things to remember which we've known since 2019, but we forget everything: mask, social distancing, hand washing. Nothing else
Promise on
matters.
to that.
Nothing else matters. If you do that, you will be as safe as you can be. That's what we need to do.
Great final words, Doc. I don't think I'm going to ask you anything else after this. We'll be as safe as we can be if we, well, keep masks and keep our distance and keep these conversations going. What else can we do? But thank you so, so much, Dr. Verma. We'll be back again. I hope not next year. I hope not the same conversation. I hope we're talking of something different next time, something more optimistic. But you were optimistic this time as well. So I'm going to carry that. Like I said, the cup is half full. And wonderful to hear your views as always. And thank you so much for taking out the time tonight. Thank
Take care.
you.
And bye to everybody who was there. Thank you for tuning in. And please implement what you heard. That would be the true success of what Jyotsna has done.
Thank you. And yes, I am recording this session. I will upload it to IGTV immediately. The YouTube link will be out in a day. So thank you, everyone. Thank you, Doc. We'll
Yep.
chat soon.
Thank you. Bye.
Bye.